But welcome everyone to the launch of Friends, Families and Travellers and Roma Support Group's latest report on Gypsy, Roma and Traveller community experiences of infant feeding, information and support services. So my name's Rosie. I'm the Health Policy and Projects Coordinator at FFT, and I'm joined by Samina and Mihai from Roma Support Group. Together with my colleague Michelle, who couldn't join us today, we make up the research team on this project. And James from FFT's training team is very kindly helping out with the tech today, so he's behind the screen. We also, so I'll be taking us through the main presentation, and then Mihai, Samina, and my brilliant FFT colleagues Emma and Lulu, who I hope have made it, will also be joining us for the Q&A segment. So James, Emma and Lulu were all part of the community working group and shared some of their experiences with us as research participants too. Can we move on to the next slide, please? Lovely. So we'll be sharing the slides afterwards, and they are quite packed out with info, so you can refer back to them later, but I'll try and breeze through them as much as we can. And we're going to start with a bit of background info about FFT and RSG and the project, and then we'll have a really brief bit of context on Gypsy, Roma and Traveller communities before we take a look at the maternal health inequalities context for the research. We're then going to give a quick overview of the existing infant feeding research and outline our methods for the project. At that point, if we have time, I'm going to try and give us a 5-minute break because it's quite a long session today. But if I do run over, we'll just run straight through. We'll then go into our findings and our recommendations, and then we'll have 15 minutes at the end for Q&A. Next slide, please, James. Lovely. So this piece of research was produced in partnership by Friends, Families and Travellers and or FFT and Roma Support Group or RSG. And together we make up the Gypsy, Roma and Traveller Consortium within the Health and Wellbeing Alliance. So FFT is a national charity based in Brighton, and we work to end racism and discrimination against Gypsy, Roma and Traveller people and to protect the right to pursue a nomadic way of life. Roma Support Group is a Roma-led charity based in East London. We're working to improve quality of life for Roma refugees and migrants by helping them to overcome prejudice, isolation and vulnerability. Next slide, please. Lovely. And the project was funded by the VCSC Health and Wellbeing Alliance. The Alliance is a collaboration between NHS England, the Department of Health and Social Care, and the Office for Health Promotion, and 18 voluntary sector organisations, which represent communities who share protected characteristics or experience health inequalities. The Alliance works to amplify the voice of the VCSE sector and people with lived experience to inform national policy and facilitate co-produced solutions to address health inequalities. Next slide, please. Thank you so much. And the next one, perfect. So the full report includes some kind of much more detailed context on Gypsy, Roma and Traveller communities, but to give just a really brief overview, the umbrella term Gypsy, Roma and Traveller encompasses various communities, including Romani Gypsies, which can be English Gypsies, Scottish Gypsy Travellers, Welsh Gypsies and Romani people more widely, Irish Travellers, New Travellers, Boaters, Showmen and Roma. So each of those communities have rich and distinct cultures and histories, and members of these communities will often have very different lived experiences. But there are some commonalities too. And can we skip to the next slide, please? So members of Gypsy, Roma and Traveller communities have some of the worst general health outcomes of any ethnic group in the UK. And again, the full report has much more info on the general health context, but in terms of maternal health, existing data shows that Gypsy and Traveller mothers are 20 times more likely than the rest of the population to experience the premature death of a child. 29% of Gypsy and Traveller parents are likely to experience one or more miscarriages, compared to 16% in the non-Traveller population. And Roma mothers experience higher rates of poor infant outcomes, such as preterm births and low birth weight, than the non-Roma population. Next slide, please. So because of all this, in 2023, FFT and RSG published a report on tackling maternal health inequalities. I've listed some of the main findings on the slides here, and they'll link to the full report once we've sent them out. But during the research process on that project, some of the main issues that community members raised were to do with infant feeding and accessing support services and information about infant feeding. So this was a real area of worry for participants, and we decided to dig a bit deeper into this for the following year's research project. Next slide, please. So that brings us to our most recently completed project. We knew already from our own research and from our experiences supporting the communities that infant feeding was a really important issue for families, but existing research on the topic was quite limited. So what published research there is showed that there can be very different norms around types of feeding depending on the particular community. Family and tradition have been shown to be really important factors in how parents choose to feed. And there are also higher rates of metabolic ailments, which can impact infant feeding, such as significantly higher rates of classical galactosemia among infants born to Irish Traveller parents. So if we skip along one more, please. And we're really proud to share our own co-produced contribution to research on infant feeding in Gypsy, Roma and Traveller communities. We've created a full-length report, which includes lots of really important background info and direct quotes from participants, as well as a much shorter summary of our key findings and main recommendations. The shorter version is just the recommendations and our key findings, but the extended version has much more context. Lovely. So next slide, please. Perfect. So our research process was shaped by input and insights from Gypsy, Roma and Traveller community members at every stage. We're also really lucky to have expert advice from maternal health and infant feeding specialists, both clinical and non-clinical. And some of those lovely experts are on the call today. So huge thank you to you. We started out with a review of the existing research and literature. And we worked together with our community working group to create our research questions and decide what topics we wanted to look at and decide how we were going to collect our data, what methods we were going to use and what would work best for community members to get involved. So once we'd kind of decided the principles for that, we consulted with maternity professionals to make any adjustments before we started data collection. We then got started on gathering the data. So we did this with an online survey, which we put out with some kind of options for supported completion. So we had some Roma advocates get involved to support people to complete the survey online, and we got 125 responses total. We also held 5 focus group sessions, some at the FFT offices and some at the RSG offices, both online and in person. And we had a total of 25 participants. However, this is a really sensitive topic for a lot of people, and we were also really keen to get dads and non-birthing partners involved in the process. So we also held 16 one-on-one in-depth interviews with both mums and dads, so we could get more into the detail of people's experiences. Once we'd started analysing the data and drawing out our themes, we held some more engagement sessions with our community working group and some more consultations with the professionals who helped us out, really to refine and finalise our findings and our recommendations, which we can share now. Could you skip forward one, please, James? And one more. Lovely. So we broke our findings down into 6 key themes. And we've got cultural norms, expectations and influences, support, information and communication, experiences with infant feeding services, economic challenges, perinatal mental health, and the perspectives of dads and partners on baby feeding. So next slide, please. Lovely. For our first theme, which was cultural norms and expectations around infant feeding, they were shown to really heavily influence individual choices and experiences. So this was mostly in line with what existing research had already said. So norms varied significantly between different ethnic and cultural groups. Generally speaking, within Roma communities, breastfeeding was considered the cultural norm, whereas for participants from Romani, Gypsy, Irish Traveller and travelling showman backgrounds, they indicated that formula feeding was more typical within their communities. But across all the different communities, participants referenced the importance of family, the health benefits of different types of feeding, and issues around modesty and the need for private space as key influences on how they decided to feed their children. So next slide, please. So throughout the report, we've included lots of direct quotes from participants. And we've got a few listed here. These are from Roma and Gypsy, Irish Traveller and Showman participants that we grouped because of that kind of shared cultural expectation. One that really stood out as we heard that same message said in different ways from a lot of different participants was a sense that you can't win. So several participants said they felt judged by health professionals if they chose not to breastfeed, but then experienced stigma within their own communities if they did want to breastfeed. Next slide, please. And so here we've grouped some quotes from Roma participants who typically had quite different experiences. Breastfeeding is much more typical within Roma communities, but many participants felt really unprepared for and distressed by common breastfeeding difficulties, like problems with supply or problems latching. So a lack of accessible information on this and also issues around the timing of information delivery were pointed out as some of the factors behind that. A really key quote here talks about Roma families not expecting support from professionals necessarily and not knowing what they're entitled to under the NHS and what would be a normal care pathway in maternity. Next slide, please. So again, there were some shared factors that were common across all the different communities. And we've got some quotes illustrating them here. So we've got some on the influence of family and community. We've got one here that says family influences a lot. That's the way it tends to be, even down to what kind of milk you use and all that kind of thing. Modesty and having access to private space to feed was another really key factor. So when you're traveling with a large group, there's not much privacy, people coming in and out of the trailer all the time. So even if people did want to breastfeed, they might have felt that they didn't have the private space to do so. But the health benefits in terms of benefits for both mum and baby were also another key factor in how people decided to feed. It's also interesting that some people noted that breastfeeding was seen as necessary for poorly babies, or as some kind of an above and beyond measure that could be taken when babies needed extra support. Next slide, please. So our next theme is support, information and communication. And this grouped participants' experiences of accessing info about infant feeding. Next slide, please. So participants shared their experiences of barriers to accessing support, which were linked to nomadic living, insecure accommodation, and wrongful refusal for primary care due to the inability to provide things like a proof of fixed address, for example. Now, these aren't new. FFT and RSD has existing examples of research about this if anyone wants to dig into that a little bit deeper, but it was especially acute for maternity care. They also illustrated gaps in the support available. So there was in particular a lack of culturally pertinent peer support opportunities like breastfeeding support groups. A lot of people talked about not feeling comfortable in mainstream support groups for various reasons. And again, we've got some more quotes on that in the report itself. People also pointed out that there was a significant reduction in the information and support they were offered for their second and subsequent children. So some mums talked about feeling like health professionals thought of them as experts once they'd already had one child and didn't offer as much information or as many options about information. But of course, this isn't the case. Each baby, each birth, and each feeding experience are unique. So people had very different challenges for different children. We were also able to identify issues around information and effective communication. One of the big things that came up was really quite rigid messaging from health professionals around feeding options. So one thing in particular was the promotion of exclusive breastfeeding as a very kind of strict message from certain professionals. And that was a problem that really put some mums off exploring breastfeeding as an option at all. The timing of information delivery was another important topic. So many families explained that they'd been told they explained that they wish they had been told more about common challenges before giving birth, rather than it coming as a shock when they were first attempting feeding. The Roma postnatal purity period, when it's observed as well, can make the timing of information delivery crucial because mums might be a bit more difficult to reach after giving birth. Again, so we had those familiar for people who have kind of been involved in this kind of area of health research. There are some familiar barriers to accessing information that we know about, but how they apply to people's maternity care experiences has been really interesting. But these relate to digital exclusion. So a lot of the participants wouldn't not necessarily have access to laptops, phones, and so on in order to access services and information online easily. Language barriers were also a major issue, as well as issues around low levels of literacy. So accessing services when the only way to make an appointment was online or being given leaflets really wasn't a successful route for information delivery. Some participants also felt that mainstream resources that they were given didn't feel culturally relevant for them. It didn't feel like those resources were for them or reflected their needs or the information that they needed to know. Next slide, please. Lovely. So theme 3, our next theme, addresses the participants' experiences of infant feeding services. Next slide, please. So some of these experiences were excellent. We had some really glowing reviews, which was lovely to hear. Most of the positive experiences that people shared really highlighted the importance of trusted relationships with individual care providers. These care providers often delivered really non-judgmental explanations of different feeding options and gave practical and tailored advice that ultimately showed respect for the parents' preferences and choices. Next slide, please. However, we also did hear some more negative experiences. We've included some quotes on this, but the main themes that emerged for those more challenging experiences were a real lack of cultural awareness and understanding from health staff, professionals making parents feel pressured to feed a certain way, although the particular type of feeding participants felt pressured towards wasn't consistent. It really varied depending on the on who you were dealing with. A lack of practical feeding support, both for breastfeeding and formula feeding. But really a lot of parents talked about the difficulty accessing any kind of support or information from professionals around formula feeding. But underlying many of these more challenging experiences, though, was an acknowledgement from participants about the pressures experienced by NHS staff and a lot of worry about the impact of NHS underfunding. So again, there's a quote here saying it's not a reflection on the staff, but a reflection on how underfunded they are. Next slide, please. Okay, so theme 4, and that was another key issue impacting participants' experiences of infant feeding, was the economic and financial challenges associated with it. So lovely. So key among these were the cost of formula and a lack of awareness around financial support available to families. Many participants also spent more than was necessary on formula because they felt that they needed to buy more expensive brands of first formula because they perceived them to be better quality. Next slide, please. So theme 5 is perinatal mental health. And this was another major factor that impacted participants' experiences. Participants shared their experiences of feeling guilt, shame, and worry around infant feeding and the consequences of this on their mental health. These feelings were often associated either with poor experiences when interacting with health services or with more general worries around infant feeding, like feeling unsure as to whether their child was getting enough food, for example. Cultural stigma around discussing mental health was also raised as an issue, particularly for Roma, Irish Traveller and Romani participants. And we also have a separate research project on understanding mental health for Gypsy, Roma and Traveller communities, and we'll be launching that report next week. So a recurrent theme among participants who'd experienced perinatal mental health issues or knew someone who had was an unwillingness to disclose or seek help for fear of social services involvement. And that fear was itself a factor in exacerbating mental ill health. People didn't want to express that they were having any kind of difficulty for fear that they'd be perceived as not managing. Participants also noted a lack of accessible, practical and culturally relevant information on perinatal mental health, especially in terms of what to expect as normal and what was kind of a red flag and when they'd need to seek help. Next page, please. So this is actually one of the only published pieces of research that our research team could identify that included direct input from Gypsy, Roma and Traveller men on their experiences and perspectives around infant feeding. It's not something that's often openly discussed by men within the communities. Like other maternity topics, it's often seen as an inappropriate area for men's input. And you can see that dynamic reflected in these quotes. So, there's certain things that we don't talk about. There's women's talk and there's men's talk. So across most Gypsy, Roma and Traveller communities, men are often expected to take more of a secondary role in the earliest stages of childcare. Most of the male participants touched on this in their input, explaining that their perceived role in caring for their families during pregnancy and postnatally was often quite heavily influenced by gender expectations and an awareness that their presence in certain spaces and conversations might not be seen as appropriate by their family. However, this cultural norm can become layered with fears around the misconceptions of health professionals who don't fully understand the socio-cultural dynamics at play. So some of the dads we spoke to worried that their absence from spaces and conversations relating to birth and maternity care could be interpreted by health professionals as a lack of engagement or interest in the well-being of their child or their partner, which was absolutely not the case. Others, though, had the opposite experience, feeling that professionals would have preferred them to be less involved during infant feeding conversations or visits. But a common thread across many of the interviews was the sense of a generational shift, with men becoming much more actively involved and much more open about speaking about infant feeding and early childcare than previous generations. Next slide, please. Okay, perfect. So I'll move on to our recommendations, and we can just have a little bit longer for our Q&A. Perfect. Okay, so based on all of these themes, we developed 11 recommendations, and some of these are more geared towards policy professionals, some more towards government, some more towards clinicians. They're more detailed on the report itself, but we'll just run through some of the key headlines here. So number one, maternity and infant feeding service providers should engage directly with members of Gypsy, Roma and Traveller communities to assess access needs and adjust services accordingly. So this process is best facilitated locally by collaboration with organisations or individuals who have existing relationships of trust with communities. Services need to be designed with literacy, language and digital barriers in mind, as well as a really sound understanding of accommodation-related challenges and cultural norms. Culturally relevant peer support opportunities like those mum and baby groups I mentioned should be created. And we also recommended that NHS England promote recruitment and training opportunities for community members and work with community advocates so that community members can see themselves reflected in the services. Next slide, please. Lovely. Number two. So Gypsy, Roma and Traveller cultural competency and inclusive services training is recommended for all maternity and infant feeding service providers. So training services can be found via the Cultural Awareness Hub, which links to different training offerings from Friends, Families and Travellers and Roma Support Group, as well as others. We've also listed particular topics for training in the report itself that you could look at in more depth. Next slide, please. So culturally relevant and accessible infant feeding information resources should be provided to maternity and infant feeding service users. Where these aren't currently available, steps should be taken to fund their development. So we've linked some brilliant examples of existing resources in the report and on this slide. But this is also a good chance to promote our current Health and Wellbeing Alliance project for this year, which is co-developing a suite of short, accessible and culturally relevant information videos around infant feeding that's designed by and for Gypsy, Roma and Traveller families. And we have a lot of the research participants from this project involved in that one too. We really hope to have these ready to publish in early 2025, so watch this space. Next slide, please. Lovely. Number four, infant feeding policy and support services must respect and support individual infant feeding choices. So effective, culturally pertinent and accessible support and advice should be available to all families regardless of which feeding method they choose, so including breastfeeding, formula feeding and combination feeding methods. So one of the big overarching messages from the participants was really feeling pressured towards certain types of feeding or feeling like their choice wasn't respected. Next slide, please. So suitable funding is critical to the delivery of safe, effective maternity and infant feeding services. Underfunding of maternity and infant feeding services should be viewed as an urgent political and economic priority. Budgets for maternity and infant feeding should be reviewed and increased in accordance with the Ockenden Report's immediate and essential actions and the latest Health and Social Care Committee report on the safety of maternity services in England as a minimum starting point. Next slide, please. So number 6, awareness among maternity service users around economic, social and psychological support available to families must be improved. So broader help and advice services should be integrated into healthcare settings. This could be delivered via a social prescribing system or following a health justice partnership model, which is an approach developed by the brilliant Maternity Action. More info on that is linked on the slides and in the report. But that model embeds legal help in healthcare services by linking new or pregnant parents with advice services through their midwife, enabling them to access benefit entitlements and exercise their rights. Next slide, please. So financial supports for families and awareness of the financial supports available to families must be improved. So we've made various recommendations on specific changes, including uprating the Sure Start maternity grant and the Healthy Start scheme in line with inflation and extending eligibility criteria, raising the basic rate of statutory maternity pay and maternity allowance to at least the national minimum wage. Next slide, please. And again, we've detailed some more of those there. There's also the policy anomaly that treats maternity allowance as deductible from universal credit, and we recommend that be corrected. And the maternity allowance treated the same as statutory maternity pay under universal credit rules. Moreover, we have the administrative barriers to maternity payments, including both the maternity grant and the additional payments to pregnant women and babies, children under 3, such as the need for separate application forms should be removed and payments made automatically after notification of pregnancy. Next slide, please. So number 8, we recommend that measures be taken to address the surging costs of infant formula. Infant formula should be recognised as an essential product for which there's no alternative and be treated the same way as other essentials such as energy or medicine. So our recommendations include exploring pricing controls and caps, as well as exploring the option of commissioning a nationally or locally commissioned first infant formula milk. Next slide, please. We've also recommended increasing Healthy Start vouchers again, but we also recommend that clear public health information should be displayed anywhere that formula is purchased, explaining to customers that there's no established health benefits to babies of buying more expensive first formula options, since all brands must comply with the same regulations around composition. There's no need for families to be buying more expensive infant formulas. Next slide, please. Perinatal mental health support services must be strengthened, suitably funded, and delivered in a culturally sensitive manner. Of course, that's a massive and complicated task, but some of the key elements of that would be that service providers should be aware when supporting members of Gypsy, Roma and Traveller communities that there may be a reluctance to seek help with mental health issues due to cultural taboos and mistrust of healthcare and state institutions. This can also contribute to a lack of awareness around perinatal mental health issues and symptoms. These barriers can also contribute to a lack of awareness around what services are available to support families. And it's therefore really important to emphasise the availability of these services before the need for them is expressed. Next slide, please. Decisions made by service providers around the involvement of social services should be handled with great care and sensitivity, as well as an understanding of the distress and harm to families that can be caused by unnecessary referrals. Next slide, please. And finally, number 11, service providers should be aware of cultural expectations around the role of father figures in traditional Gypsy, Roma and Traveller communities. dads and partners following more traditional cultural expectations around male presence in maternity contexts shouldn't be misinterpreted as a lack of interest or involvement in family life. Next slide, please. Brilliant. So we've now got plenty of time for our Q&A. We don't need to use up all of the time, of course. But James, if you could stop sharing the screen for me so we can see each other, that would be lovely. We've got a lot of people in the meeting. So if there is anything you'd like to ask, feel free to raise your hand and we can call on people one by one. We do also have my brilliant colleagues from Roma Support Group here to help with questions as well as James and Emma and Lulu, who I hope have been able to join us, but I haven't. We've got a lot of people in here, so lovely. And also, if you'd rather not speak directly, you can pop a question in the chat. That's totally fine. Lovely. So I can see a question from Anita in the chat asking about the postnatal purity period. And I think this might be one that Samina and Mihai could respond to. There's more information about it in the report as well.
Yeah, sure. Happy to take this question. Of course, Rosie has given all of us a few details into the kind of diversity within the range of Gypsy, Roma and Traveller communities, and this means that the communities which are under this umbrella are quite diverse and have different sort of experiences. Within the Roma community, we can see this even more kind of diversity, having Roma from various different countries who settled in the UK in the last decades, were also from different tribes or groups of Roma as well. So we're talking about very diverse communities. Also, we're talking about more modern Roma people within the Roma communities and more traditional families or groups of Roma as well. Now, this purity period refers to how some of those more traditional Roma families behave after a birth in the family. So I have to say, it does not kind of is not this sort of rule of this period, purity period, does not strictly apply to every Roma family, and therefore we might have more kind of modern Roma families who do not really stick to that, but we also in our work might come across more traditional families who feel this is very important for them. So what in practice, what it means for us is that after the birth, the mother is kind of required to sort of withdraw from the wider family life and from kind of doing usual day-to-day sort of family activities such as cooking, cleaning, and so on, and is given time to sit with her baby, to bond, to feed, and so on. That in some ways, mother is considered sort of impure after the birth, but it's seen in the community and in the tradition sort of as something which is positive, which is good, and it's just giving the mother that time she needs to kind of bond with a child. And in that period, this means that if you have such a family who is very traditional and sticks very much to that, it means that she might, the mother might miss appointments. The mother, there might be problems on engagement and communication there during that specific period. Now, it can take a few weeks from our experience, up to like 6 weeks or so. But again, it's not something that would apply to everyone, but in some situations might. Also, in some cases, fathers might move out for during that period from the house, and might have new relatives coming in, women sort of female relatives coming in to help with cooking, cleaning, and doing the sort of day-to-day sort of things. Now, as a practical example, I'm a Roma myself from Romania. I know this, for example, 25, 30 years ago was actually the norm in the community, and everyone was sticking to this. And I remember as children speaking when we were seeing a mother, giving birth in like a week time or 2 weeks time, she was out walking with a baby and so on, that was considered something really, really bad. And everyone was speaking about that. But now, today, at least in my community, in our area and so on, in Romania, where I'm from, this is no longer the norm. Everyone thinks it's normal for a mother to go out, for things like this to happen. So it did change. This is why I say it's very, very important to bear in mind. It does not apply to everyone. Yeah. Thanks.
Lovely. Thanks so much, Mihai. I also linked in the chat to page 43 of the report that talks about it a little bit more. And it's also in our broader maternal health inequalities report from last year. I think for service providers, the key message is just kind of factor that in terms of when you're giving information. So remembering it might be harder to reach folks afterwards. So how have people found is the best way to engage with the Gypsy, Roma and Traveller community? It's been challenging for us to make contact and offer help and be accepted. So this is a really, really big question that obviously we get a lot. And again, I can't recommend enough our training offering. We've got brilliant James on the line who delivers that training offering. And I know RSG also have great training offering on this, and we collaborate together as well to deliver joint trainings too. In terms of general principles, I don't know if I might invite James to.
Yeah, hello. I'm here. Hi. Yeah, just in terms of reach, that is, like you said, Rosie, it's a common question people ask. We don't know who the Gypsies and Travellers are in our area. We don't know where they are. We know that often Gypsies and Travellers have a real reluctance to declare their ethnicity, so it's sometimes difficult to get a handle that way. But one of the obviously there's several ways, but one of the main recommendations we make is that organisations go onto the FFT website. We've got a services directory, which is a really useful interactive map, and there's a search bar, you can type in your area name, postcode, etc., and it will bring you up a list of often smaller charities in your area, and not all of them are Gypsy, Roma, Traveller organisations, but the majority of them are. But yeah, so going onto the services directory, finding out which Gypsy, Roma, Traveller organisations you have in your area, and reaching out directly really to them. And if you have, for example, you want to increase registrations, a registration drive, just reaching out directly to that organisation in your area, explaining who you are and what your aims are, and essentially using that organisation as a bridge between your service and the Gypsies and Travellers in your area. Those services will have well-established relationships and trusted relationships with Gypsies and Travellers in the area. So yeah, using those, I suppose, as a bridge between your service and local Gypsies and Travellers is one of the sort of main recommendations that we make. And we can put a link to the services directory in the email that we send off after the session with all of the resources, the slides and recording, etc. But you can always just log on to the FFT website and check it out. But we'll put it in the pack anyway.
Yeah, I'd like to add to that. Indeed, it's a very good suggestion for services to identify who is out there working with our communities. But I'd like to kind of suggest also to, for services interested to engage or increase their engagement with our communities, to kind of map out the local communities to see who is out there actually. We're talking about a city or an area where there is a predominant Roma sort of presence, or is predominantly, I don't know, a Romani Gypsy presence or travelers and so on. So find out exactly who you really want to engage with before, and then try to get a little bit of background information so to help kind of plan that engagement activity. And do not assume that you already know who you're dealing with, because the kind of approach might differ on that. So if, for example, there is a high presence of Roma and you are looking to engage more with Roma in that area, then there might be problems of the language we use to in your approach. Might be a need for interpreters there. The materials might have to be developed in a different way, and so on. So that's one thing which I think needs to be considered. Secondly, I would also say, once you do identify a local group or local activist or someone who is out there and can help with engagement and increasing engagement and so I would say do not assume that this group already has the capacity and the skills to support your service. What happens out there in most of the cases is that you have a local organization who maybe is one or two people who they themselves are, not necessarily have the right skills to fully engage with the service, in this area. So what I'm trying to say that they might also be supported in their efforts to support your work in engaging with local services. I know for Roma, this is the case in some places where you have, one or two very, very dedicated and open people who really want to support with whatever they can. But they might themselves not have very good English skills. They might themselves be working, sort of low-paid jobs, long hours, and so on. So they might have to take days off, and then that means they might need budget money for their time and so on. So, yeah, I hope that this will help. With that question.
Thanks, Mihai.
Maybe to add a bit more, if, for example, obviously this applies if you are thinking of kind of planning some sort of engagement, or if you're thinking of a strategy to increase that engagement and that contact. But if, for example, let's say in your service, you come across suddenly you have a woman who comes to give birth and so on, or a woman who becomes pregnant and approaches your services and so on. And you might think, okay, what can I do to engage with this person throughout her pregnancy and so on, to successfully and efficiently do that. Of course, as James mentioned, there is a challenge on our side on admitting our identity. So that will not be easy to be identified if you're dealing or not with a person from the Gypsy, Roma and Traveller communities. And what at least personally, what I've seen helping is having in such situation where you might, where you assume that you might deal with such a person, is having a very friendly, positive approach, I would say. At least within the Roma community, unfortunately, a long kind of history of negative engagement with professions, including health professions. I'm making us to believe and to expect kind of negative attitudes when we engage with professionals, including in health environments. So what I'm trying to say is that a Roma woman might present, herself being pregnant, or might go to hospital pregnant and so on, and she might assume that there will be negative treatment or negative attitudes towards her being a Roma, and therefore might engage. But if we've noticed that if someone is out there, even if, of course, even if there is no interpreter, someone who is genuinely positive and friendly and trying to make an effort to engage makes a huge difference then throughout the whole process. And then obviously adding in interpreting, adding in culturally appropriate resources, adding in a little bit of culturally sort of awareness of how to speak about certain issues, then this all makes all that experience a lot more positive and successful.
Thanks, Mihai. That's brilliant. And I'm seeing in the chat that we're getting more questions as well, and I'm making a note of them. We will come back to them, but I can see that Anna has her hand raised as well. Hi, Anna.
I'm just trying to start my video. Oh, here we are. Yeah.
We can see you.
Thank you so much for this very interesting presentation. I'm really glad to see that this work has now been published, and I'm really looking forward to reading it. And thank you so much for mentioning the health justice partnerships that Maternity Action is doing. I was just wondering, how can we, as other kind of organizations, national and local, how can we support you to get these messages out?
Well, it would be fantastic if people are able to share our reports on their social media and with their contacts. That would be excellent. I think that's the reason as well we have our summary version as well as the extended part. The extended full report is quite lengthy, which I think would be really useful for people who want a bit more background on the different topics in a bit more detail. But the summary report is much shorter. It's only 15 pages. So for kind of busy clinicians and policymakers and all that kind of thing, it's much easier to just run through. But our social media team our comms team on Twitter and TikTok and Instagram have been sharing some of the links to this as well, so you could retweet there, and that'd be fantastic. Thank you. And for context as well, Anna is one of the brilliant professionals who helped us out from the maternity action side. So with huge thanks to Anna for that. I can see Lucy has their hand up.
Hiya, yeah. So I work with ABC Parents and we do a lot of sort of promoting breastfeeding. But if we remove the caps on the prices of formula, like if we put caps on the prices of formula, use them as an essential, yes, they should be classified as medical, but then we're using vouchers and stuff, we're contravening the UNICEF code, but equally we're then promoting formula. So we're not supporting families, and I understand that there's free choice and there are difficulties, but when we're not supporting the most disadvantaged communities, including GRT communities who have issues with accessing services anyway, and prejudices that they face, we're now basically promoting formula, and there is going to be, by doing that, we're going to have a decrease in the amount of families that access it, because this isn't just going to be for GRT, this is going to be nationwide, which then means that we're going to have, for a country with the worst breastfeeding rates, we're going to make them even worse. And actually what we need to do is change the narrative. And I appreciate that all the research that's gone into this, but we need to change the narrative, because I have friends who are Romas as well. And I have friends from all different communities. And actually the prejudice that they face here is a barrier to breastfeeding. So you know, we need to change that, and we need to get the support out there, and then look at actually if there is, and also promote educating healthcare professionals whose usual first line of response is baby's not gaining weight, have some formula, rather than baby's not gaining weight, what's the issue? Right? Because we know that only a small percentage of people cannot breastfeed. So then we need to look at, okay, so you have an informed choice, and then you have healthcare professionals who can refer on to get that support that they may not be aware of. Has baby got tongue tied? Is baby positioned? Is baby latched properly? In a supportive environment that is culturally aware, right? And we have in ABC Project, we have Albanian speakers, Romanian speakers, you know, we have all different cultures. We have Somali speakers, we have Ghanaian and Nigerian women who peer support, who can speak the languages as well. So we need to move that away from white middle class to, and that's usually how breastfeeding is seen in this country, to culturally inclusive. By doing that, we can increase those breastfeeding rates. And we need to have a support system that encourages that as the first port of call, because that, and someone just said about the wording being no other alternative. There are other alternatives. Formula should be an informed choice, not a first point of call. The alternative to that, like expressing, is completely valid as a form of breastfeeding, and we need to have this in these communities. And actually I would be more interested about how we can access those communities to get that support and engage them before we look at changing UNICEF codes and further contravening them, especially in countries like the UK that has atrocious children's rights records in terms of our policies and how our policies contravene those. Like when we're going into the 2-child cap, the Healthy Start vouchers, when we're going into formula making and stuff.
Definitely. I completely agree with you on those. And I really want to stress that the recommendations that we've given about formula really, really need to be seen within the wider recommendations that we've given as well, that really do stress access to improved breastfeeding support, better cultural competency in breastfeeding support, and that much broader picture. But we do also need to address the issues that participants raised around access to formula and how difficult that had been. It's a very tricky balance to strike, when by no means trying to encourage or kind of discourage breastfeeding. We want to make sure that is the most kind of well facilitated option and the easiest option, and that everyone is supported in doing that. Absolutely. And that's not the case right now. It's very clear in the rest of our recommendations that this is kind of a much more holistic approach than just that. But those specific recommendations around infant feeding formula were to address the experiences that participants raised with us who didn't have that alternative, who weren't able to breastfeed, or who didn't feel that breastfeeding was an option to them for various cultural aspects as well. So it's kind of, I'm not disagreeing with you, and it sounds like you're doing brilliant work, but we needed to address that point too. Does that make sense?
Yeah, and there is also a prescription route for families that need formula and that cannot access this because there is a health need. So in terms of breastfeeding, if a family is breastfeeding and they cannot breastfeed for whatever reason, there is a medical need for that formula, then actually there can be at the discretion of the consultant, and I'm not talking about these specialist hypoallergenic formulas, but at the discretion of the consultant or the registrar, they can be prescribed. So you do have that as a secondary issue in terms of that as well, because we can look at changing codes and everything, but they're going to have implications on wider societies, like the whole society as a whole. Completely agree that by increasing Healthy Start for those who have opted and made an informed choice of formula, perfect. But I think when we're messing around with doing some of this, discounting the cost of it by using points, then we are treading really dangerous ground. Because I know, and coming away from GRT communities, I know many people who have chosen to not breastfeed because they didn't know different. And actually, with the right support and education, some of them have had 4 or 5 children and then breastfed their 6th or 7th because they've had the right support and education. And I think completely agree that this can be a barrier to keeping babies healthy. And we've seen cases where formula is being watered down and babies' health is being put at risk. But I also think, like someone's mentioned, donor milk, you know, those kind of things where getting donor milk in the hospital is extremely hard. There's no information on pumping, and very few peer support structures work on long-term pumping. They more look at sort of like hand expressing in the initial stages. And one of the things that I get a lot in the groups that I'm covering is, oh, actually, why is my milk suddenly stopped? Why is pumping painful? And peer supporters do a fantastic job with the basic support. But when they're in hospitals and that, they can't go beyond that, and they can't challenge the views of the medical profession. And I think that if we can provide a cohesive strategy in terms of challenging those views as organizations who have specialist knowledge, and also putting that support in place, then, and increasing the Healthy Start, then actually some of those other strategies you've mentioned may not necessarily be needed. So we don't need to be in contravention of UNICEF codes.
Absolutely. So there's, again, a much broader context within the recommendations in the report, and we are trying to have as kind of holistic approach as possible with this. And honestly, we can't stress enough how important that element of improved support and improved kind of culturally competent support around breastfeeding, the experiences that people shared with us really reflected that. We had some excellent experiences that were just kind of exemplary for people who had brilliant breastfeeding support, and then we had the opposite end of the spectrum as well. So we're kind of really tried to reflect all of the different needs that were shared with us there.
I can add to that quickly. If you and everyone here, you know, you will look and read the report and the details included there, and I think it was reflected in a way in the presentation as well. The kind of general sort of overview from the people that we've reached out to and work with for the purpose of this research, but also from the wider community that we are working with in other projects and that we do. Unfortunately, that you know, negative, or maybe not necessarily negative, but not at the same time necessarily positive experiences that mothers have when engaging with health professionals around pregnancy and after pregnancy, and the conversations there are not necessarily positive and are influencing opportunities for mothers to be on finding out about more details about breastfeeding and the importance on that, or more details about other forms of feeding their babies and how that may impact the children and so on. And sometimes this leads to, for example, you know, a Romani Gypsy mother who might want to breastfeed or might want to know more about infant feeding in general, because the engagement, because of the communication and the way it happens, she misses opportunities to find out those details and that information there. And then she will go to what she knows that is the norm, or it's what everyone does in her community, being that formula feeding or breastfeeding or what, other form and so on. So I think that's at least what I've observed in our experiences, that very few of the Roma mothers or, to be or mothers who just who gave birth have positive examples to give out there, saying that I didn't know what to, how I will do around feeding, but there was someone in the hospital and they were really nice and spoke and talked me through different things and helped me make that decision. That's very rarely that this is happening. And then the options and the choice that they will make after birth, it will then sit down with the experience that they have in the community, with what the family is saying, or with their sort of ability to find information and take that decision on their own. In the case of Roma, that mostly goes to breastfeeding because that's what the community is saying. That's what the family is pushing mothers to do. It's always saying, breastfeed, this is the best, this is the, you have to do this and so on. But in Roma and Gypsy, in Traveller, it may be different, yeah. And so this is why I say that, yeah, that engagement, the way that we speak with mothers and so on, and with fathers as well, it's very important to create that sort of positive initial kind of engagement, which can lead then on to possibilities and opportunities to speak about feeding and about other things later on.
Thanks, Mihai. And in the report as well, there is much more context on the kind of different cultural elements that go into people's choices around baby feeding. We talk a lot of, there's a lot of quotes from participants around breastfeeding and their kind of experiences with cultural stigma for Roma and Gypsy and Irish Traveller families especially. So there's a lot more context in the report, and also again another plug for our project that we're working on at the moment is some resources for community members. And again, we're working with a lot of the participants from this project to create some short videos on breastfeeding and combination feeding and kind of different types of formula feeding, as well as the other topics that we talked about, like the financial aspects and perinatal mental health. And some resources for dads as well. So hopefully that'll be available early 2025. So I'll just check in on the chat again. I can see one from Bryony. Is there any issue with using words such as breasts when talking about breastfeeding, breast cancer screening? Yes, that is for some community members that can be a real issue. Natural feeding is kind of the preferred term for a lot of people. This doesn't apply for everyone, but there is sensitivity around talking about kind of body parts, potentially, and kind of gendered health issues. So some of the language you use can be really, really important. Again, that depends on which community you're working with or trying to target in terms of outreach and that kind of thing. But yes, natural feeding is one of the alternative phrasings. Miha, would you want to comment on that at all? I know that's kind of especially sensitive for Roma families too.
Yes, indeed. The word itself might be a bit challenging to use, for Roma people, because kind of culturally sort of will feel that it's disrespectful to use the word breast in the conversation, the word itself. So finding alternatives or referring to the breast is recommended. So I think discussions about feeding are normal. People, understand and are kind of happy to have those discussions and so on. Some, as I said, it's not one rule to apply to everyone. Yeah. But generally, finding alternatives of using the word breast or something instead of that are helpful to make people feel comfortable to speak about it. Some people are more modern and have absolutely no problem with that, and they are open and can use the word freely, but others might find it a bit kind of challenging to use it. And yeah.
Yeah, and just to say on that, maybe, yeah, I guess first of all, just being sensitive around the language. So oftentimes, you know, if you say, oh, I know this is sensitive, can I ask this or can I use it? Oftentimes I found that a lot of community members say, yeah, sure. But once there's that acknowledgement of, oh, that might be sensitive or referring to certain body parts, just that you're aware that that could be sensitive. Oftentimes people are more open rather than just going into it without that acknowledgement.
Even we've seen, and you know, mothers or even fathers and so on, if they feel they have to use the word breast or other kind of sensitive words, they will apologize before they will actually use the word. You know, just because they think it will be disrespectful if they don't apologize before.
Thanks, guys, definitely. And again, that's something that came up in terms of resources that are provided as well, and the images that are used. So for our resources that we're creating, we're working with a community artist, and we're doing some kind of co-production sessions with our research participants, our steering group and focus group, to kind of work out what kind of imagery will be kind of most appropriate. But yes, it's something that a lot of people might not kind of register as an issue at all, but it's just useful to have in the back of your mind when you're working with new families, and you're getting to know people, that could be a sensitivity. And if you're designing outreach materials or info leaflets, that kind of thing as well, it's something to factor in.
Maybe while Rose is going through the chat box, Rosie, please stop me once you identify a question. To speak about, you know, what we've kind of come across in discussions we had with mothers around what might kind of influence the decision on how they feed the babies. We've seen very, very few materials out there for Roma mothers, for example, in, I don't know, respective language and so on, regarding the different, I don't know how to call them. There are things which people spoke about regarding, for example, the breast milk. There are people saying, for example, if the baby cries too much when immediately after the birth and so on, some mothers are saying, "Oh, my milk is not good enough. It's too weak. Oh, I don't know how to latch." And so there are different sort of really practical things which, if a mother is not aware immediately after the birth and in that first day and so on, then that will strongly influence them making the choice actually, or just go and, you know, buy formula milk because that's certainly good and so on. They might, for example, hear it from other family relatives and so on. If the child is crying too much, sometimes it's happening simply because they can't latch properly. But then because of that, they think that either the milk is not good enough, it's too weak, it's not enough in quantity and so on. And then they will make the choice of you know, going and buying formula milk. And after you do that in the first or second day and so on, then it's very difficult for those mothers to come back to breastfeeding and so on. So lack of information around that, lack of resources around that, you know, a lack of, and unfortunately, like immediately after the birth, you know, the health profession doesn't really know how to talk with the mother. Maybe there is no one there to help with interpreting and so on in that first day, which is crucial. That leads to, you know, mothers feeling kind of, I have to feed my baby, I have to do this, and then will make that choice right away, and it will be very difficult to bring them back to, you know, to change the option.
Thanks, Mihai. Yeah, again, that kind of point about the timing of when information is delivered as well came up a lot for a lot of the participants, people talking about kind of wishing that they'd known some common challenges earlier and what would be normal and like a normal challenge with breastfeeding, and not a sign that this is, you know, something very wrong. So I've pulled out a couple more questions from the chat. There was one about, I'd love to know about how donor milk, especially from the NHS, is seen by communities. I couldn't give you a kind of a blanket answer to that one. I think that would really depend on the individual. I do know of community members who've donated milk. So that is something that's we're aware of. But I think it would be quite individual. Again, depending on the community, there is quite a significant stigma around breastfeeding, full stop, in some areas. So that would factor into it. Mihai, Samina, is that something you could comment on as well?
Well, I've never heard about use of donor milk. It may sort of happen. I know, for example, like historically, or you know, if we're looking at the way that Roma live in various European countries, living in very small settlements, in segregated areas and so on, which is not necessarily happening in England and the UK. I know that people who live in that sort of context in Central and Eastern European countries and so on, it may be that a mother might breastfeed children of someone else in the family if there will be a problem there with feeding the baby, but it will be in kind of exceptional circumstance. But in England and so on, we don't have experience.
It's not something that came up in our research in terms of the focus groups in the interviews.
Just to sort of echo really what Mihai just said, you know, from an Irish traveller perspective, more personal experience, I suppose, more than anything, but I've never heard of anyone using donated milk, and yeah, in all of my life, to be honest. My sort of initial gut instinct is that it would be potentially frowned upon, but that would just be going on the fact that I know I've never heard of it discussed before, and sort of, you know, just the personal experience more than anything else. But yeah, it's not something that I've heard any parent using, but this is, like I say, just sort of on a personal level that may be different in the sort of wider communities. But yes, I've heard of donated milk just in, you know, in general, but not in terms of parents within the community using it or donating it, actually. But as you say, there are some that have, so obviously I'm not completely sort of got my finger on the pulse entirely.
Yeah, I'd say I think maybe something to be aware of, that it could be sensitive if it's a topic you're broaching with parents as from a service provider perspective. But in terms of how people will respond to that, I couldn't give a blanket answer. But I would say that a lot of the participants we spoke to did talk about kind of when babies are premature or poorly or have extra needs, breastfeeding being seen as the thing to do, and definitely more acceptable in that context, even in, you know, within communities where it's maybe not seen as the done thing. So that's a dynamic that could come into play there as well. Lucy, you want to go ahead and unmute?
Hiya, so I just wondered, so and I know it's not just for GERT communities, but we know that mothers and what you were saying about having that information early, is there a way to collaborate to make resources that we can disseminate through some of the NHS providers on here, and the ones we come into contact with, and our maternity services? So instead of being just focused on the mothers, these can dispel myths. You know, I'm going back 5 years, it maybe even 6, when I did my research around GRT communities and safeguarding and their NHS and their access to services, and why they're often seen as a safeguarding risk when actually there's a cultural discrepancy there. I'm just thinking, like, if part of their access to services and part of, you know, it just generally, we know breastfeeding is an issue with time and resources and everything else. Perhaps there's a way that we can work on providing a resource for doctors, midwives, maternity nurses, that can be like an information handout to dispel some of that misinformation, to change some of the mindsets a little bit, as well as working on a resource that is GRT specific for the mothers, that they have maybe in a resource pack that is there that they can access, that has that basic information and where to get further support. Because we're not going to change the narrative if we don't take drastic action. And I always believe that action starts with education, and positive change is always productive. It's the start of, you know, change leads to productive and positive outcomes. So I don't know if that's something that perhaps we can look at doing. It can be with or without ABC. It can be from a personal interest point of view, to make that so that, because we all know healthcare professionals are busy, they may not read even a 15-page report properly. They might just glance it, they might look at it, they might go, oh, I don't like that bit, and not read the rest of it. But maybe something like a resource pack where we have dispelling the myths around GRT communities to improve access to healthcare, and then having this basic information that they can then hand out to parents. So I don't know if that's something that's within your guys' remit.
Absolutely, there's definitely a need, and that's definitely something we'd be really keen to support on. We're small teams at FFT and RSG, so in terms of capacity and funding and that kind of thing, we'd have to talk separately, but those types of resources are absolutely needed, and could have such a huge impact. And there is work being done on those kinds of resources, both for professionals and for the communities themselves. It would be, especially for the community side of things, the research and the kind of co-production process there would be really, it would need to be planned really carefully. It would be, you know, something that would need to consider to make sure that it's truly co-produced, you know, made by and for, but definitely necessary. And again, I've popped my email in the chat, so let's talk about that more. Thanks, Lucy. I've got some more questions that we drew out of the chat. So we're going to ask about recommendations on recruiting to peer support services or healthcare from communities. Again, that's I'm not sure whether that's more asking about kind of how to engage with potential peer support advocates, or kind of contact it, or the recruitment process. But I've lost who asked that, so I can't ask them to follow up. But I'd say, again, the principles would be the same in terms of general engagement, you know, working with existing relationships, and making sure that you're kind of building on existing trusting relationships. Depending again on the community that you're targeting, there'd be different measures that you'd want to take that you might need to address in terms of language barriers potentially, and on digital access barriers and that kind of element. So they all would factor into. But if the original question asker wants to follow up with a little bit more detail on that, I can try and give a more focused answer. But in the meantime, we also had a question about which languages would be most useful to produce information in. Samina and Mihai, would you want to come in on this one?
Yeah, so again, I refer back to the diversity of the communities under the so-called GRT umbrella. And of course, that reflects the diversity of languages that people in these communities speak. Now, in regards to Roma communities, of course, there will be various languages. Roma who are in the UK or migrated to the UK from various European countries. Most of the Roma, which we know in England, for example, are either from Romania, Slovakia, Poland, Czech Republic, and Bulgaria, and a little bit Hungary and so on, but they can be from all across Europe. We've, as I said, we've met, you know, Spanish Roma, Portuguese Roma, Serbian, Albanian, and so on. So it's a huge diversity, but mostly they are from, as I said, Slovakia, Romania, Poland, Czech Republic, Bulgaria, and Hungary, I would say. So resources can be developed in those languages. But if we do that in either, for example, Romanian, Slovakian, and so on, we'll have to be careful about the vocabulary use, because Roma primarily we speak our own language, which is called Romanes, and our own language is very kind of basic in terms of vocabulary, and therefore that influences our understanding of the languages from the countries of the origin. So if professional jargon is used in those respective languages, that might kind of impacts the way we understand. Now, using the word Romanes, the language Romanes comes with its own complexity and difficulties, because we have within our own language different dialects as well, and so on. So yeah, it all complicates the situation very much. We recommend using videos in Romanes language if possible, as a first kind of option. And secondly, we also recommend maybe working with what we call Roma bilingual advocates to help communicating kind of issues and so on. And if you have to do a leaflet or some written material in a Central or Eastern European language, try to use basic sort of language, try to use maybe images, or so to make it as suggestive as possible to help with ensuring the message is communicated.
Thanks, guys. And yeah, I'd say similarly for a lot of kind of community members who English will be their first language, there's still elements to think about in terms of what words you use and what kind of words you use. So really avoiding kind of medical jargon is really crucial. And again, the sensitivities about certain kind of gendered body parts and that kind of thing. So saying things like natural feeding rather than breastfeeding, for example. So yeah, something to consider. I'm really aware that we've come up on time. We're at 1:30. This has been brilliant. Thank you so much to everyone for getting involved with your questions. If you have any more, if there's anything that we weren't able to address today, my email's in the chat. Feel free to get in touch separately. And I'd love to hear from you guys, and we'd love to hear what you think of the reports as well. But thank you so much, everyone. And we'll let things go now. But it's been brilliant. Thank you very kindly.